Dr. Gottlieb, thanks for being here. We were just hearing from Alex Gorski from J&J. These timelines they're laying out would be the fastest vaccine development in history. Do you believe that this is possible and we might actually have a vaccine in early 2021 that can be deployed to the public?
Look, it's aggressive. I think we will get a vaccine to this. I think you have to put it on a timeline of 1.5 to 2 years. That would be a reasonable timeline. That would be an aggressive timeline. But it's possible that we'll have a vaccine that we might make available under an emergency use authorization where we authorize it for use in certain populations. You might want to vaccinate certain high-risk populations, perhaps in an expanded clinical trial. And that could be available as early as the fall, given the progress that they're making to date. But I think to have a fully approved vaccine available for mass inoculation of the general public on that kind of timeline, that's pretty aggressive.
Before then, of course, we're hoping for drugs that will work to treat the disease. A new study coming out today on hydroxychloroquine from Wuhan. Some analysts pretty optimistic about that. But I want to ask you a question that Sarah Eisen asked me today, and I think you would give us a better answer, which is, if these drugs are being deployed widely already right now, should we be seeing an impact in the numbers of deaths and severe cases? And if we're not seeing that, does that tell us anything about how well they work?
Well, not necessarily. Hydroxychloroquine is being used very widely, both in the U.S. and in Italy, and doctors in Italy are using it prophylactically. So doctors who are caring for patients, there's reports that they're taking it as a prophylactic to prevent themselves, hopefully, from getting infected. They're obviously still getting infected. It's possible that the drugs are having a treatment effect that's not very robust, that you wouldn't detect without randomized, properly conducted studies. And that's why it's so important to conduct those studies. The study that you're talking about was a small study. It was certainly hypothesis generating. It looks interesting, the data itself. It's hard to understand, how the study was conducted and what kind of supervision it was conducted under. But it seems to be promising enough that we should be conducting additional research. And in fact, those studies are going forward. I'm more optimistic that we're going to have a treatment by the fall. I think some of the antivirals that are currently in development look like they have activity against this virus. They might be more effective in early disease rather than late disease. Right now, a lot of these drugs are being used in very advanced patients where simply interrupting viral replication after you're very sick might not provide a real benefit. But if you give it to someone early in the course of the disease, someone who's likely to have a bad outcome, there it could be more effective. And we see that, for example, with Tamiflu in the use of Tamiflu in the setting of flu. The other products that I'm very optimistic about are the antibodies, because we've done this before against viruses where we made monoclonal antibodies that targeted the virus effectively. We did it with Ebola. We also did it experimentally with MERS, and we tested that in large animals, and it worked. I think companies like Regeneron, which are developing those antibody drugs, if they're successful, those could be available for mass production as early as the summer.